The chemical use program started in 2006, adjacent to the outpatient behavioral health program, for the purpose of serving adolescents and families who have struggles with addiction, chemical use, substances, and they're able to come into our clinic to receive services surrounding addressing that area. The age group that we serve are adolescents as well as adults. Our adolescent program is for 13 to 19 years of age. Adult program starts 19 and above. We have two levels of care. We have an outpatient program as well as an intensive outpatient program. So those are two different levels of care. A youth that comes into the program, we will evaluate through a chemical use evaluation what their needs are. If they're in the lower need, they would be an outpatient treatment, which involves individual psychotherapy services, group psychotherapy, as well as family therapy. IOP services, or intensive outpatient, involves 9 to 12 hours of treatment services per week. That's more intensive, that's where the family is very involved, and there's a lot of group psychotherapy that's involved in that. To make a referral, families can call the main hotline number, as well as the behavioral health clinic to call, and they will be asked a question about what the concerns are with their adolescent, and that may tell us that they need the chemical use program. And then at that point, within 24 to 48 hours, a clinician will call them, talk about what the needs are, and have them schedule an appointment to come in. The Boys Town Chemical Use Program has a couple unique aspects to it. One is family involvement is important and pivotal. So if we have an adolescent that comes in, their family will be involved and will be informed. The parents have the most knowledge on what's going on with that adolescent, and that's very important to us. In addition to that, our program has those services, as I mentioned, individual, family, and group. So we individualize our treatment to the needs of that family and of that child and what their diagnosis is. The other part of the chemical use program is we are a duly credentialed program, which means all the clinicians in the chemical use program have a dual license. They're able to provide services for the substance use as well as any mental health difficulties. So those services can be combined and they can be working on those aspects together. We are dedicated to serving our adolescents and families and supporting them in becoming productive adults.